The Ghana Health Service in the northern region is set to immunize more than 400,000 children this year for measles-rubella. According to the service, Ghana's demographic and health survey for 2022 and 2023 shows the region has covered 56.5% respectively, which is far less than the 95% target coverage required to achieve measles elimination. There's more in this report.
The objective of the immunization is to reduce measles and rubella morbidity by preventing new cases and associated complications, improve access to measles and rubella vaccination service for all children, especially those in underserved communities and high-risk districts. Addressing the media at the Northern Regional Launch, the Northern Regional Director of the Ghana Health Service, Dr. Abdullahi Abukari, said elimination of measles is possible if population immunity is kept at more than 95% coverage over long periods through routine immunization.
Vaccination coverage has stagnated for some time now. More than 10% of our children are enriched with immunization services. Therefore, continued efforts are required to fully protect all our children from vaccine-preventable diseases. In order to achieve measles elimination, 2 doses of measles-rubella vaccine are needed. And we as Ghana Health Service, with a mandate to provide primary health care, are expected to cover about 95% of routine coverage with 2 doses of measles-rubella vaccine. As a region, ladies and gentlemen, the Ghana Demographic and Health Survey for 2022 indicated that 56.5 coverage. In 2022, the expanded program on immunization survey showed that 76.9, that is our coverage, and which is far less than the 95% target coverage, which is required to achieve measles elimination.
He said the northern region is also set to roll out its malaria immunization across the system.
Well, the vaccination drive is being replicated in the Bono East region, and Anas Sabit joins us with updates on this. How's the exercise going so far, Anas?
Provide comprehensive on all vulnerable groups.
Health authorities in the Bono East region have also kick-started this particular campaign with the region targeting about 209,000 children between the ages of 9 and 59 months to be vaccinated against measles and rubella within the next 5 days, starting today and then ending on Sunday, October 6. The reasons, according to the Health Directorate, is because measles cases in recent times have been increasing, with the region recording 23 cases in the year 2023. And this year, from January to date, already some 43 cases of measles have been recorded in the Bono East Enclave. And so Regional Director of Health Services, Dr. Paulina Clara Pia, has been telling us how necessary this exercise is, and the very reason why they feel parents and stakeholders in the area should collaborate to ensure that this exercise is a success in the region. They've instituted teams, outdoor teams. They have people who will be targeting children in schools, because we've been going to some schools already to make sure this is done. And there are also teams that will be targeting out-of-school children. And if you go to the far east of the region, through East and Sene East areas, we have some island communities already. A team has been dispatched to that area to ensure that those children or children within the island communities are equally vaccinated within the next 5 days.
Thank you, Anas. We can now speak to Dr. Kwame Amponsah-Chiano. He's head of the expanded program on immunization. Thank you for your time here on Joy News today. Now, one of the key challenges you would face on the ground is vaccine hesitancy. How are you planning to deal with this?
Hello, good afternoon.
Good afternoon.
I could only hear how you're planning to deal with something.
Okay, Doc.
You are not audible, please.
Can you hear me now? I'm hoping my connection to you is better. I'm asking that one of the challenges you would face on the ground is vaccine hesitancy. How are you planning to deal with this challenge effectively?
Well, I'm not too sure about vaccine hesitancy, but of course, usually when you are doing a program like that, you may come across one or two people who may not have had enough information. What we do is that we use a mix of strategies to get to the caregivers and the other secondary targets. For us, the unit of operation is the district. So at the district level, they normally will work with community members, the leaders, religious leaders, the district assembly, the assembly members, of course, the honorable DCs. They also work with the schools, the creches, and all that. And we know they've done all these. We also support them from the national level through what we did yesterday, for example, the launch and then the media engagement. An example is what we are doing now. So all these things we think should be able to help for the eligible children and their caregivers to be adequately informed. And for that matter, they bring their children and make them available for this exercise.
What is your target with this vaccination drive?
Well, we are targeting to reach approximately 5.3 million children between 9 months and 5 years, just before they attain 5 years.
Would there be any special focus on demography?
Come again, please.
Would there be any special focus on demography, like where you stay?
Demography?
Yes.
Can you calm down a bit? Because I don't understand that, please.
In the vaccination drive, I would like you to clarify for me, would you be going hard on certain areas, like probably the Ashanti region or the Greater Accra region, because of some of the cases you have had reported?
No, this is a nationwide exercise. All regions are involved, all districts are involved. Okay. And so it's not targeted. It's across the country, from Zuarungu to Bisco, and from west to east.
Dr. Kwame Aponsa-Achiano, thank you for your time here on Journey today. He's Programs Manager for the expanded immunization program. Thank you for your time. Let's